So imagine a public safety hotline, right? One that's designed to stop crimes before they happen.
Right.
It's basically set up to catch people right at the edge, offering them like a lifeline so they never actually cross over into doing harm.
Yeah, that's the ideal scenario.
Exactly. But now imagine looking at the data from that hotline and realizing that the overwhelming majority of the people calling aren't standing on the edge at all.
They're already over it.
Right. They are the ones who are already committing the crimes. Today, we are looking at a massive 2026 study by Salter and a team of international researchers. And I mean, it completely upends how we view child protection, public policy, and really the dark realities of human motivation.
It really does. It's a study that forces us to look past our most comforting assumptions,
Yeah.
They surveyed nearly 5,000 men across Australia, the United Kingdom, and the United States, and they were asking incredibly direct, difficult questions about sexual attitudes, interests, and, well, behaviors toward children.
And it wasn't just for like academic curiosity,
Right.
right?
No, not at all. The goal was to find actionable data. They needed to figure out why some men with these interests actively seek psychological help and, why others just don't.
Okay, let's unpack this. Because before we can even look at who is picking up the phone to a helpline, the baseline numbers in this study require a serious reality check.
Yeah, they do.
What did this survey actually find in the general population? Like just setting the stage for you listening.
Well, the baseline findings are they're significant. Across the pooled sample of these nearly 5,000 men, about 1 in 7 or 13.1% reported some level of sexual interest in children.
I mean, I have to pause there. 1 in 7.
I know, it's a striking number.
Let me just play devil's advocate for a second, because that number feels incredibly high to the average person.
Yeah.
Are we sure this isn't just, survey bias, or maybe people misinterpreting the phrasing of a question on an anonymous online form?
It's a completely vital question to ask, but the methodology here was designed specifically to account for exactly that.
Okay, how so?
The researchers used highly validated screening tools. They ensured total anonymity to encourage honesty, but they also filtered out inconsistent or, troll responses.
Right, people just messing with the data.
Exactly.
Yeah.
So the 13.1% figure is robust. And it really aligns with the growing understanding that this is a measurable, persistent public health reality. It's not just some ultra-rare anomaly.
Wow.
And furthermore, what kind of confirms the validity of the data is that this number isn't uniform.
What do you mean?
It varies quite a bit depending on the country, which implies that cultural and environmental factors are actually at play.
Oh, interesting.
Yeah, it was highest in the United States at 16.9%.
Wow.
It was lowest in the United Kingdom at 10.4%.
Wow.
And Australia sat kind of right in the middle at 12.2%.
Which means public policy actually has levers it can pull, right? Like if the numbers change based on the country, this behavior is responsive to external influences. But zooming in on that specific group, the 1 in 7 men who reported a sexual interest in children, the data shows that roughly 44% stated they actively want help for those feelings.
Yes, nearly half.
Yeah.
And that specific cohort, the help seekers, is really where the entire narrative just completely fractures.
Right, because if you are listening to this deep dive right now, your natural inclination is to look at that 44% and just assume they are the tragic but morally upright group.
Exactly, the ones fighting it.
Yeah. The narrative we've all internalized is that the man who wants help is the one who is horrified by his own thoughts. He's struggling in total isolation, desperately seeking therapy so he never harms a child.
Right.
We automatically assume that wanting help is a sign of innocence, or at least, a sign of successful self-restraint.
And that is exactly what the data disproves.
Really?
Yeah. The researchers separated the men who want help from the men who don't want help, and they analyzed their actual reported behaviors.
And what did they find?
Well, the men who report wanting help are actually 2.78 times more likely to have already engaged in some form of child sex offending compared to the men who don't want help.
Okay, here's where it gets really interesting. Wait, so the desire for help isn't a preventative measure at all.
No.
It's a reaction to already crossing the line.
Precisely. The statistics are glaring. The men reaching out for help aren't, by and large, the ones struggling with abstract thoughts in a vacuum. They are active offenders.
That completely flips the script on how we view intervention programs.
He really does.
I mean, we picture someone calling a hotline to say, stop me before I do something terrible.
Right, right.
But the data says they are much more likely calling and saying, I am already doing something terrible and I need a way out.
Exactly.
So when we say offending in this context, what are the actual mechanics of it? What exactly are they doing?
The offending we are seeing in this help-seeking group is predominantly online. The digital landscape is the primary vector here. When you compare the men who want help to those who don't, the help seekers are twice as likely to knowingly and deliberately watch child sexual abuse material, or CSAMA.
Wow.
And it's not just passive consumption either. The interactive elements are even higher.
Meaning they're directly communicating with children.
Yes. The men who want help are nearly 3 times as likely to have flirted or had sexual conversations with a child online. They're 3.4 times more likely to have used a sexually explicit webcam with a child. And they're almost 3 times as likely to have actually paid for online sexual interactions or content involving a child.
So we have a group of men who are actively offending in the digital space, consuming abuse material, messaging kids, facilitating this whole market financially. And they're the ones who are disproportionately raising their hands saying, I want psychological help.
Yes, that's the paradox.
But if moral awakening isn't what's driving them because they're already actively engaging in the abuse, right? What is the actual catalyst? Like, why call?
To understand the catalyst, we really have to pull back from their browser history and look at who these men are in the physical world.
Okay.
The demographic data gives us a very clear, very unexpected profile. The men who want help are 1.75 times more likely to be married or living with a partner compared to the men who don't want help.
Wait, really? So if they have spouses and they are embedded in families, their motivation for calling a hotline clearly isn't some sudden crisis of conscience. It's pure risk management.
You hit the nail on the head.
They are terrified of getting caught by the people sitting in the next room.
What's fascinating here is the psychological mechanism of risk and loss. You are exactly right. These aren't isolated loners.
Right.
They report significantly higher perceived social support across the board. They feel highly supported by their significant others, by their family, and by their friends.
Wow.
And crucially, they are 1.83 times more likely to work with children in their day-to-day employment.
I mean, they are deeply entrenched in their communities then. They're coaches, teachers, husbands, active social participants.
Yes. They have constructed a very normal, perhaps even highly respected public life. But underneath that, they are engaging in highly illegal, deeply stigmatized behavior.
Right.
So the motivation to seek help isn't necessarily a sudden burst of empathy for the victim. It's driven by the terrifying realization that their double life is becoming unsustainable.
House of Cards is falling.
Exactly.
Yep.
The fear of their spouse finding out, the fear of their friends abandoning them, the fear of losing their career and facing total public ruin. That fear becomes heavier than their compulsion to offend.
It's kind of like, it's less of a moral awakening and more like a company doing damage control after a massive data breach.
That's a great way to put it.
They aren't trying to be highly ethical corporate citizens. They're just trying to contain a toxic spill before their investors find out.
Right.
It's like a white-collar executive who only calls a defense lawyer when he realizes the auditors are about to uncover the embezzled funds. He's looking for a lifeline to protect his lifestyle, not looking to atone for his sins.
That is the exact dynamic at play. The help-seeking is driven by a desperate need for self-preservation. They want help managing the behavior so that the behavior doesn't destroy this comfortable life they've built.
But that creates an incredibly volatile situation.
Extremely.
Because they have a lot to lose and they know it, but they are still actively offending. If you are a married man with a good job and supportive friends and you are terrified of losing all of that, how do you even operate knowing the massive risks you are taking?
Well, you hide. And the study provides some really chilling insights into their digital footprints.
Oh, I bet.
Because they are highly socialized and, very aware of the stakes, they engage in deliberate digital camouflage. They are far more likely to use encrypted messaging apps to conceal their activities from both law enforcement and, frankly, their own families.
Which implies a high degree of premeditation.
Yes, absolutely.
This isn't someone just accidentally clicking a bad link. The data shows they are taking calculated, proactive steps to build a secondary, hidden infrastructure for their offenses.
Exactly. The men who want help have 2.78 times greater odds of using Viber and double the odds of using Skype and WhatsApp compared to the men who don't want help.
Jeez.
They are actively seeking out platforms where end-to-end encryption or easily deletable histories provide this false sense of security. But what's even more alarming is that their behavior isn't just hidden, it's escalating.
Escalating in what way? Like, are they moving from online to physical offenses?
Well, the study specifically tracks an escalation into what we call paraphilic deviance.
What does that mean?
That essentially means an escalation into extreme, atypical, and often violent sexual interests. It's a known psychological phenomenon where the initial stimulus loses its effect over time, and the user requires more extreme content to achieve the same arousal.
Like building a tolerance.
Exactly like building a tolerance.
Yeah.
The group wanting help is 2.74 times more likely to consume bestiality pornography.
Oh, wow.
And they are 2.26 times more likely to watch violently rough sexual content.
So they are actively covering their tracks with encryption while simultaneously diving into increasingly extreme, violent corners of the internet.
Yeah.
That brings up a massive psychological contradiction, though. If a man is actively offending, seeking out extreme pornography, using encrypted apps to hide his tracks from his wife, but he is also answering a survey saying, "I want help," what is happening in his head?
It's a huge disconnect.
Yeah, how does he justify his actions to himself while simultaneously looking for an exit door?
To manage that contradiction, they rely heavily on cognitive distortions.
Okay.
The researchers looked at the attitudes these men hold. And, you would assume that someone who wants help would have a clear-eyed view of how harmful their actions are.
Right, you'd think they'd see the damage.
But the data shows the complete opposite. The men who want help are actually more likely to endorse what they call restrictive stereotypes than the men who don't want help.
How does a restrictive stereotype work in this context? Can you give an example of what that actually looks like in practice?
Yeah, a restrictive stereotype means they latch on to societal myths that minimize or completely deny the abuse.
Oh, I see.
They might tell themselves things like, children are naturally sexual, so it's consensual. Or if it's just online and there's no physical contact, there's no real victim. It's just pixels on a screen.
So they are actively lying to themselves to neutralize the guilt.
They have to. I mean, remember, these men see themselves as normal family men.
Right.
If they fully internalize the devastating, lifelong harm they were causing to real children, the psychological weight would just be unbearable. So they build these mental walls.
Wow.
They use these restrictive stereotypes to justify their ongoing behavior, even as the mounting fear of being caught drives them to look for professional help. They are literally holding two contradictory realities in their mind at once.
They are building the mental rationalization to survive their own actions while simultaneously realizing they need someone to pull them out of the fire they started. So if we take this entire landscape, the fact that help seekers are active offenders, that they are driven by the fear of losing their social standing, that they use encrypted camouflage, and that they lie to themselves about the harm they cause, how does society actually use this counterintuitive data to protect children?
Well, if we connect this to the bigger picture, it forces a massive pivot in how we approach this as a public policy issue.
How so?
Historically, the state response to child sexual abuse has been almost entirely focused on the post-offense phase, right? The criminal justice system arrests, locking people up after the damage is already done.
Right, reactive.
Exactly. But this research demands that we push heavily into the realm of public health and secondary prevention.
Which means intervening before law enforcement has to get involved, getting to the root of the behavior before a child is victimized.
Yes.
The study mentions a few secondary prevention programs that are already attempting this. How do they actually operate on the ground?
Two of the most prominent examples are Stop It Now and the Prevention Project Dunkelfeld, or PPD.
Okay, tell me about Stop It Now.
Stop It Now operates in the U.S., the U.K., and several other countries. It basically functions primarily as a confidential helpline.
And people just call in.
Yeah, and when they call, they aren't met with immediate criminal interrogation. They are met with non-judgmental support to help map out their triggers and build coping strategies.
Interesting. And what is the Prevention Project Dunkelfeld? That sounds much more intensive.
It is. So Dunkelfeld is a German term that roughly translates to the dark field or the hidden figure of crime, the offenses that occur but never come to the attention of authorities.
Got it.
PPD operates in Germany and offers actual in-person therapeutic treatment to self-identified individuals in the community. And it operates on strict therapeutic confidentiality.
Wait, really? Even if they are offending?
As long as the individual hasn't committed a hands-on offense that legally mandates reporting, they can receive medical and psychological treatment to manage their urges without the immediate threat of arrest.
Wow. It's treating it like a dangerous pathogen that needs to be contained through healthcare rather than just waiting to arrest the infected person after they spread it.
That's a really good analogy, yeah.
But what is the actual track record of these programs? Like, do they actually work?
Well, they experience incredibly high demand, which proves there is a large cohort of people desperate for an off-ramp from their double lives.
Okay.
But a consistent, frustrating reality for these programs is exactly what this study confirmed. By the time people pick up the phone or walk into a clinic, they're usually already offending.
Right.
In the UK, for instance, data shows that between half and four-fifths of the people calling the Stop It Now helpline have already engaged in some form of child sexual offending.
So the fire alarm is only ringing after the house is in flames.
Exactly.
The secondary prevention is acting more like tertiary containment. So how do we get them to call before they cross the line? If we know exactly who they are now, married, employed, terrified of public ruin, how do public health campaigns reach them earlier?
By fundamentally changing the targeted messaging of those campaigns.
Okay.
Historically, prevention messaging relies on a moral appeal. It says, protect children, recognize the harm you are causing.
Right.
But we now know that an appeal to moral conflict simply doesn't work for the people most likely to engage, because they are already using cognitive distortions to ignore the harm to the child.
Right. The restrictive stereotypes.
Exactly. Instead, public policy campaigns need to be ruthlessly pragmatic and target their actual fears.
You have to threaten the data breach. You have to threaten the lifestyle.
Exactly. The messaging shouldn't just be about the child. It needs to vividly, aggressively illustrate the consequences to the offender.
Wow.
Campaigns should highlight the immediate loss of their spouse, the total alienation of their friends, the destruction of their career, and the permanent public ruin that inevitably follows when they are caught. You have to make the fear of the consequence greater than the compulsion to offend, and you have to trigger that fear early.
That is a very sharp, almost aggressive shift in tone for a public health campaign.
It is.
It's basically throwing out the idealistic hope that people will just do the right thing and instead leveraging their own self-interest to ensure public safety.
It is entirely pragmatic. And furthermore, the study suggests another critical, kind of underutilized intervention point.
What's that?
Well, we saw earlier that these men have highly elevated rates of consuming violent, rough, and deviant adult pornography.
Right, building the tolerance.
Exactly.
Yeah.
Secondary prevention services could develop targeted messaging right at the point of consumption for that material.
You mean like placing the messaging directly on the adult platforms they are visiting?
Yes. Warning consumers that extensive use of violent adult porn is a known precursor and correlate to child offending. If you can interrupt that escalation right when the tolerance effect is pushing them toward more extreme material, you might be able to trigger their fear of ruin before it ever crosses over to children.
Wow. So what does this all mean? If you are listening and you care about the safety of children in your community, the landscape of protection looks vastly different than we've been led to believe.
If it does.
We started with an assumption that the men asking for help with a sexual interest in children were the innocent ones, bravely fighting their demons in isolation. But the data from this 2026 study tells a much darker, much more complicated story.
Yeah.
The men most likely to seek help are highly socialized. They are your neighbors, they are married, they have friends, they work with kids, and they are already actively offending using encrypted apps and cognitive distortions to hide their actions.
Right.
They aren't seeking help out of a pure moral awakening. They are seeking help because they are terrified of their double life collapsing.
And understanding that reality is absolutely vital. We cannot design effective public health campaigns based on how we wish offenders thought. We have to base them on how they actually think. Recognizing these counterintuitive truths is the only way we can push software developers to build smarter safety by design features. And it's really the only way policymakers can design intervention programs that actually intercept abusers before a child is ever harmed.
We have to take off the rose-colored glasses, look at the actual mechanics of the behavior, and basically use their own self-preservation against them to protect the vulnerable.
Exactly. But this raises an important question, though.
What's that?
Well, the data clearly shows that strong social bonds, having a partner, having friends, having a reputation, are the primary levers driving these men to seek help. The fear of losing those relationships is the catalyst for change.
Right.
But what happens to the men with a sexual interest in children who are completely isolated?
Oh, the ones who don't have a public life or a reputation to lose in the first place.
Exactly. If the fear of losing relationships is the primary trigger that forces an active offender to finally pick up the phone and ask for an off-ramp, how do public policy experts and prevention services ever reach the deeply solitary individuals who feel they have absolutely nothing left to lose?